Caregiving is a labor of love. It's a role that many take on out of deep affection and commitment to their loved ones. Whether it's a parent, a spouse, or another family member, the bond that drives you to care for them is powerful and profound. This journey, while filled with moments of tenderness and connection, can also be incredibly demanding. The responsibilities you shoulder are immense, and the emotional investment is significant. You find yourself constantly balancing their needs with your own, often putting their well-being ahead of yours. This selflessness is admirable, but it can also lead to feelings of being overwhelmed. You care for your loved one with all your heart. Every day, you wake up with the intention of making their life a little bit easier, a little bit brighter. You assist them with daily tasks that they can no longer manage on their own, from bathing and dressing to preparing meals and administering medication. Your presence is a source of comfort and stability for them, and your dedication does not go unnoticed. However, the constant vigilance and the never-ending list of tasks can take a toll on you. You want the best for them. You strive to provide the highest quality of care, ensuring that they are safe, healthy, and happy. This often means making sacrifices in your own life, whether it's cutting back on work hours, giving up social activities, or even neglecting your own health. The love you have for your loved one is the driving force behind your actions. But it's important to recognize the impact this can have on you. But taking care of someone can be hard. The physical demands of caregiving can be exhausting. Lifting, transferring, and assisting with mobility can strain your body, leading to aches, pains, and even injuries. The emotional demands are equally challenging. Watching a loved one struggle with their health can be heartbreaking, and the constant worry about their well-being can be mentally draining. It can be physically and emotionally draining. The long hours, the lack of sleep, and the emotional roller coaster can leave you feeling depleted. You might find yourself running on empty with little energy left for anything else. This exhaustion can affect every aspect of your life, from your physical health to your mental well-being. You might feel tired all the time. The constant demands of caregiving can lead to chronic fatigue. You might find it hard to get a good night's sleep, as your mind is always racing with thoughts of what needs to be done. Even when you do manage to rest, it might not be enough to fully recharge your batteries. You might not sleep well. The stress and anxiety that come with caregiving can make it difficult to relax and fall asleep. You might wake up frequently during the night, worrying about your loved one or thinking about the tasks that await you the next day. This lack of quality sleep can further contribute to your feelings of exhaustion and burnout. You might worry constantly about your loved one. The responsibility of ensuring their safety and well-being can weigh heavily on your mind. You might find yourself constantly checking on them, making sure they are comfortable and that their needs are met. This constant vigilance can be mentally exhausting, leaving you with little time to relax and unwind. It's okay to feel this way. It's important to acknowledge your feelings and understand that they are a natural response to the challenges you face. Feeling overwhelmed, exhausted, and worried does not mean you are failing as a caregiver. It means you are human, and you are doing your best in a difficult situation. Caregiving is a big responsibility. It requires a great deal of time, energy, and emotional strength. The tasks you perform are essential to your loved one's well-being, and your dedication is commendable. However, it's important to recognize that you cannot do it all on your own. It's important to remember that you're not alone. There are many others who are going through similar experiences, and there are resources available to help you. Support groups, counseling, and respite care can provide you with the assistance and relief you need. Many caregivers experience these feelings. Sharing your experiences with others who understand can be incredibly validating and comforting. It can help you feel less isolated and more supported in your caregiving journey. Acknowledging the challenges is the first step to finding support. By recognizing the difficulties you face, you can take proactive steps to seek out the help and resources you need. This can make a significant difference in your ability to cope with the demands of caregiving. Don't be afraid to ask for help when you need it. Reaching out for support is not a sign of weakness, but a sign of strength. It shows that you are committed to providing the best care possible for your loved one, while also taking care of yourself. Remember, you are not alone in this journey, and there are people and resources available to help you every step of the way. Respite care can give you a break. It's when someone else cares for your loved one for a short time. This could be for a few hours, a day, or even longer. Respite care gives you time to rest and recharge. You can use this time to do things for yourself. You can catch up on sleep, see a friend, or just relax. Taking breaks isn't selfish, it's essential for your well-being. When you take care of yourself, you can be a better caregiver for your loved one. There are different types of respite care available to suit the diverse needs of caregivers and their loved ones. Each type offers unique benefits and can be tailored to fit your specific situation. You can choose what works best for you and your loved one. It's important to consider the level of care required, the preferences of your loved one, and your own needs as a caregiver. In-home care is one of the most flexible options. A professional caregiver comes to your home, providing personalized care in a familiar environment. This can be especially comforting for seniors who prefer to stay in their own homes. They can help with things like bathing, dressing, and meals. In-home caregivers can also assist with medication management, mobility, and other daily tasks, ensuring that your loved one receives comprehensive care. Adult day centers offer another valuable option. Your loved one spends the day at a center, engaging in various activities and socializing with peers. These centers provide a structured environment with professional supervision. They can socialize and participate in activities such as games, exercise classes, and arts and crafts. This not only keeps them mentally and physically active, but also provides a sense of community and belonging. Short-term residential care is another option. Your loved one stays in a facility for a few days or weeks, receiving round-the-clock care from trained professionals. This can be particularly useful if you need to travel or take a longer break. It provides peace of mind knowing that your loved one is in a safe and supportive environment while you are away. Talk to your doctor or a social worker. They can provide valuable guidance and help you navigate the various respite care options available. They can also connect you with local resources and support services. They can help you find respite care resources in your area. Whether you need temporary relief or ongoing support, there are many options to explore. Taking the time to find the right respite care can make a significant difference in the well-being of both you and your loved one. It might feel overwhelming to think about taking a break. The responsibilities of caregiving can be all-consuming, leaving you feeling like there's no time for yourself. But it's crucial to remember that taking care of yourself is just as important as taking care of your loved one. Planning can make it easier. Here are some steps to help you navigate this process. First, identify your needs. What specific tasks or responsibilities are causing you the most stress? Is it the daily routine, medical appointments, or perhaps the emotional toll of caregiving? Make a list of these tasks. This will help you understand what you need a break from. It could be anything from managing medications to handling household chores. Once you have a clear picture, you can start to think about what kind of help you need. Next, consider what you would like to do with your time. Do you want to pursue a hobby, spend time with friends, or simply relax? Knowing how you want to spend your break can help you stay motivated and make the most of your time off. It's also important to talk to your loved one. Open communication can help them understand your need for a break. Explain that taking time for yourself will ultimately make you a better caregiver. They might have concerns, but reassuring them can ease their worries. Let them know that this break is not just for you, but for them as well. A well-rested caregiver can provide better care, and this can improve the overall quality of life for both of you. Explore your options for respite care. Research different types of respite care and their costs. There are various options available, from in-home care to adult daycare centers, and even short-term stays at assisted living facilities. Look into what fits your needs and budget. Once you've decided on the type of care, make the necessary arrangements. Contact providers, schedule the care, and ensure all the details are in place. This might involve meeting with the care provider, filling out forms, and discussing specific needs and preferences. Remember, it's okay to start small. You don't have to take a long break right away. Even a few hours a week can make a big difference in your well-being. Use this time to recharge and do something that brings you joy. Taking these steps can help you manage the stress of caregiving and improve your overall quality of life. By planning and communicating effectively, you can ensure that both you and your loved one are well taken care of. Even small breaks can have a significant impact, so don't hesitate to take that first step. Section 5. Overcoming guilt. You deserve a break too. You might feel guilty about taking a break. You might worry about your loved one or feel like you're not a good caregiver. These feelings are normal, but remember, you deserve a break too. Taking care of yourself is not selfish. It's necessary. When you're rested and recharged, you can provide better care for your loved one. Don't be afraid to ask for help. Your health and well-being are important too. Section 6. The benefits of respite care. For you and your loved one. Respite care isn't just beneficial for caregivers, it can also benefit your loved one. They can socialize and make new friends, participate in engaging activities, and receive specialized care from trained professionals. Respite care can provide a positive and enriching experience for your loved one, while giving you much-needed time to rest and recharge. Section 7. Resources to help you find respite care. Finding respite care can feel overwhelming, but there are resources available to help you, your doctor or social worker, the elder care locator, the Alzheimer's Association, and your local area agency on aging. These resources can provide information, support, and referrals to respite care providers in your area. Don't hesitate to reach out for help. Section 8. Taking the first step. Don't wait until you're burned out. It's easy to put your own needs on hold when you're a caregiver. You might think you can handle it all, but it's essential to prioritize your well-being. Don't wait until you're completely burned out to seek respite care. Taking breaks can help you avoid burnout and be a better caregiver in the long run. Remember, asking for help is a sign of strength, not weakness. Section 9. Remember, you're not alone. A final word. Caregiving is a journey, and it's okay to ask for help along the way. Respite care is not a luxury, it's a necessity. It allows you to take care of yourself so you can continue to care for your loved one. Remember, you're not alone. Millions of caregivers are facing similar challenges. Reach out, seek support, and prioritize your well-being. You deserve it.